because that's where the tumor is. So in all three cases, we have elevated levels of cortisol. Okay? Now, here's another situation. Elevated levels of cortisol, low levels of CRH, low levels of ACTH. That situation would typically tell you that the tumor is located where? In the adrenal gland. But they do a scan, adrenal gland is normal. The situation of my kid's babysitter's father. Couldn't find a tumor in any of these three places. There is one more location that produces cortisol, and those are in the lungs. So lung cancer, certain kinds of lung cancer can result in increased levels of cortisol. It's kind of a weird place to think of cortisol coming from. The lungs, and we don't typically think of as an endocrine organ, all right? But it is another source. Okay, the last pathway, this is the same pathway for birth control. So if you're taking birth control pills and you have estrogen and progesterone, okay, same thing. They're higher levels. They result in lower levels of hypothalamic chemicals, which result in lower levels of pituitary, which lowers the normal amounts of development in the ovaries. The one I want to look at, and the last one we're going to do, is prolactin. So for those of you that are on the hyperprolactinemia, I ask you to look at cortisol. Okay, that's one of the components. The other component is prolactin. So again, just another look at the pathways here, but this one is unique. So far, all the examples I've given, the hypothalamic molecule is excitatory or inhibitory to the pituitary gland. Excitatory, okay? So it's a releasing factor, not an inhibitory factor. So the more the hypothalamus makes its hormones, the more the pituitary gland is going to respond. Okay? The next organ is different. So the mammary gland makes a hormone that regulates the milk synthesis, okay, the synthesis of milk proteins. You can also do some other things, but that's what it's primarily known for. And so that hormone is prolactin. Now typically prolactin levels only increase during pregnancy and after birth while the mom is nursing. So unless you're pregnant right now or nursing, you should have less than 3, what is the measurement? Nanomolecular, I forget what the actual measurement unit is, but normal is 3 to 4. Okay? While you're nursing, it's probably around 30 to 50. In a tumor, it can be 90 to 300 or 400. Okay? So this is not involve a tumor of the mammary gland, but the normal response is as prolactin levels increase, let's start backwards here. Hypothalamus releases dopamine. Dopamine is the chemical that travels from the hypothalamus into cat bed 1 and down the portal veins and out cat bed 2. But dopamine is not a releasing factor, it's inhibitory. Okay? So with high levels of prolactin, dopamine levels actually go up. then is inhibitory to the pituitary gland. Actually, prolactin is from the pituitary gland, not from the mammary gland. So the milk is here. Sorry about that. So dopamine goes up. When it gets to the pituitary gland, it results in decreased amounts of prolactin. So we have the opposite effect here. There's as milk production goes up, okay, and prolactin levels go up, the hypothalamus makes more dopamine, which cuts back on the prolactin. So the more dopamine there is, the less prolactin, the less dopamine, the more prolactin. Okay? So someone who is nursing would have less dopamine being in their portal veins. Someone who stopped nursing or is not pregnant is going to have higher levels of dopamine and very little prolactin. Yes?
So is it this cycle which affects the amount of milk that comes in, essentially? Because some women get more milk and some women get less.
Yeah.
So if they have a problem, they would get less.
Well, there's a variety of things that could occur.
Okay.
So in fact, back in the 50s or 60s, for women, it was popular to not breastfeed. And doctors were telling new moms and dads that it was better to bottle feed because then you would know how much your baby ate and that could be controlled and so on. And so to decrease the time that a woman's milk was being produced after the baby was born, because it gets painful if that builds up and your baby's not nursing, they would wrap binders, large pieces of fabric around the woman's breast and kind of keep them compressed. But they tried giving them a drug that would decrease the dopamine. And it did, but side effects were an extreme amount of nausea for the first week or so. And a lot of women didn't want to take it, so that kind of lost favor. But the drug is, there's a couple of different ones, but one of the most common ones is known as bromocriptine. It's the generic name. Brand name is Parladel. And what it does is it is a dopamine agonist. Does everybody remember what an agonist is when we talked about neurotransmitters? So it works the same as. It binds to the receptor, the same place that dopamine does, and it has the same effect as dopamine, or it can also increase the amount of dopamine being produced. So bromocriptine is going to act as dopamine or increase dopamine levels and therefore result in a decrease in prolactin. Okay. So in the hyperprolactinemia, just to give you an idea, all right, this is actually based on myself. So after my first son was born, I don't want to take too much time with this, but after my first son was born, typically I got married when I was in my early 30s, 32, and got pregnant with my son a few months later. So he was born when I was almost 33. And I didn't want to wait too long to have another child, my husband and I. And so normally in the wintertime I'd gain 5 or 6 pounds. And spring would come and I'd walk 8 miles a day and cut my calories down to about 1,000 calories. And I'd lose those pounds in the next 6 or 8 weeks. And I'd be my summer weight. Okay. Well, when my son was born in August, I was teaching school, and so spring came along as, all right, this is my normal time. So I started running, and I was doing 6 miles a day, 10 grams of fat, and 900 calories. And I didn't lose any weight. And my husband, bless his heart, you're not getting your heart rate up enough. And I'm like, doesn't matter. I'm doing the exercise. I'm putting out, the effort. So a couple years went along. I'm about 154 right now. And when I got pregnant, for my entire adult life, I was 128 to 132. So I was like, okay, well, I want to get pregnant again, but I'm at 153. I don't want to end up at 172, you know. So we tried, you know, a couple years. Okay, let's get pregnant. I want to lose 10 more pounds. So, okay, we're going to really work on this. So started in spring. From April till October, I lost 3 pounds. And my period stopped. Because I wasn't getting enough fat in my diet to make the steroid hormones. All right, it's really difficult to get pregnant when your period stops and your husband's gone 3 weeks out of 4 traveling. So I finally went to see the doctor, and he put me on Clomid, which increases the number of eggs that are released. And I didn't get pregnant that month. The end of that month, he put me on bromocriptine and doubled the Clomid, and I got pregnant with twins. So there are twins in the family, but whether it was the Clomid or that, I don't have any idea. Clomid is a drug that is an infertility drug that increases the number of eggs that are released. So if you aren't releasing any, so it's more likely that you would release 2 eggs instead of 1, kind of thing. So let's see, that was 1996. So I've been on bromocriptine twice a day since then. With bromocriptine, if I go off of the bromocriptine, I'll gain 10 pounds in a week. Okay. If I go back on it, I'll lose those 10 pounds within a week, but I can't lose much more. And so that got to be kind of the theme of my life for a very long time. I went to see a neuroendocrinologist because my OBGYN who put me on a bromocriptine wanted me to have an MRI before I went back on it after the twins were born. And so I had hyperplasia. I didn't have a tumor. The cells that I had were too big. So at the time, I asked him, and I told this story to you guys last semester, I asked him, well, what's the relationship between prolactin, high levels of prolactin? My levels were 90. What's the relationship between prolactin and weight loss? His answer was, the only way to lose weight is to exercise and diet. This is an endocrinologist. And as you'll see, there's thyroid, there's cortisol, there's a whole bunch of things that can affect weight loss. So I didn't even tell him what my educational work background was. I just, okay, fine, that's your thing. So then over time, it was like, all right, my medical doctor lost 30 pounds. He said, you know, I just went on a really strict diet and exercised a lot. So I was like, okay, I can do that if that's what it takes. So 2005 and 2006, I walked 25 to 30 miles a day. I can only do that in the summer. It took a long time, but I do it in the early morning. I get up at 4:30. I'd come back to the house about 10. I'd do it again in the evening. I'd walk to my son's baseball games and so on. Went on the diet, no dinners. I didn't lose any weight until like 2 weeks before school started. And then I was probably losing, then I had to quit and I lost a little bit more. It was probably muscle. It's like, I can't walk 30 miles every day. It's not helping anyway. So I was about 166. I stayed 166 all summer long. The next day, I was like, this is, so I bought an elliptical. And I did the elliptical 4 hours a day. That's the equivalent of about 24 miles, 30 miles. Same result. Nice and toned, good aerobic exercise. The weight loss wasn't happening. So I started doing some research. Well, what could be going on here? Because there's just not much out there. And this is where the case study comes from. All right. By then I had another MRI. The doctor's office called and said it was normal. I then went to see an endocrinologist and I said, well, my MRI is normal. He goes, no, it's not. He said, here's the report right here. Probable pituitary tumor, but may be a shadow. So I was like, okay. Well, the treatment for a tumor is surgery through the nose and removal of part of the pituitary gland. There's 2 doctors in California that do enough of those surgeries to be good at it. You have to do about 300 a year. If they're not good at it, you either have to have the surgery done again or they take too much of your pituitary gland and you end up with Addison's instead of Cushing's. So I'm going, I'm fine with the way I am. But So what's going on here? So in the Stock syndrome, the thing that's covered in the hyperprolactinemia, the idea is that other cells in the anterior pituitary can form a tumor, all right? And in the Stock syndrome, as that tumor enlarges, it blocks the portal vein, or part of the portal vein. So you would get a decrease in releasing hormones coming from the hypothalamus to the anterior pituitary. Now, in most cases, that would cause an increase in the other hormones, right? If you don't have, you would cause a decrease in the other hormones because you wouldn't have the releasing factor. If it's blocking dopamine, though, what would be the result? An increase in prolactin, all right? So I was thinking, well, maybe I have an ACTH tumor, which is making too much cortisol, which is the difficulty to lose weight, and that's causing a decrease in the dopamine, which is increasing the prolactin. I tried to talk about this with my doctor, my OBGYN, and he says, Marcia, you're the expert on that. I just know OBGYN stuff. So I still haven't resolved it because I decided I wasn't going to have the surgery anyway. But I was trying to figure out something that could apply to both. So pituitary adenoma, which is what I do have, are cells, too many cells making the prolactin. Okay? Whether or not I have the ACTH, I haven't really spent much time going on it, but it made a really nice case study with endocrine and reproductive tied in together. So I currently take bromocriptine, which lowers my prolactin levels to 3 to 5. Now that I'm past menopause, when I don't take it, instead of rising to 90, my prolactin levels rise to 30. Okay, so I probably can go off of it or just reduce it to 1 pill a day, but my doctor retired and I haven't seen a new group yet, so we'll talk to them about that. Bromocriptine elevates dopamine, which is similar to serotonin. Okay? They are broken down. Anybody remember from the nervous system how serotonin and dopamine and neuroepinephrine are broken down? MAO. Okay, monoamine oxidase. So guess what I have to be careful of taking? MAOIs, monoamine oxidase inhibitors, because that means it's going to increase any other dopamines or serotonins. And I'm already taking a dopamine agonist. So there's an at-risk for serotonin crisis. Okay. So that's some of the things they talk about. Sometimes this is because of the serotonin. Sometimes people who are depressed or have other brain disorders are given this drug as well. So it can be something to watch out for. I happen to get migraines, and the drug that I take for migraine is an MAOI. Bromocriptine is the very first drug listed as contraindicated. You should take 2 at the time. My doctor, I told that, and he said, well, I've never heard of that before. I think it's okay for you to take. So he said, let me call a neurologist friend of mine, and I'll call you back. And he said, my neurologist friend said it should be fine. And so far it has been. But I just am aware I have to be on the lookout for rapid spikes in blood pressure and heart rate, stuff like that. But anyway, I wanted to give everybody a background to that, and we do have people doing the hyperprolactinemia case study, so kind of a clue as to what you're looking at, but you can come and talk to me more if you want.
Is this drug used for Parkinson's?
Yes. It is. Alrighty, so we're going to stop there and come back at 10 after, and we'll do lab. Okay? Lab is basic anatomy lab. Recognizing the models is really easy, I believe. So it's just like this is the adrenal gland, this is the thymus, and so on. And then there's also histology, and I'll show you some slides, and you guys can get the microscopes out and learn to differentiate the histology. That's our lab activity. Okay? And we'll be in the other room tomorrow. What room number is it? I believe it's 104.
Yeah.
Is it?
Yeah.